Dr. Kahng, I would like to talk to you about periodontal disease, about gum disease, about gingivitis, which really are all the same thing. Just maybe, gingivitis is a slightly lesser state of gum disease than a full-blown gum disease. Now, every dentist will say that if you have gum disease and do not fix it, you will lose your teeth. They get all wiggly-woggly, and then they finally fall out. Now, that's bad. Not only did you have a stinky mouth for a few, 2, 3, 5, 6 years till that happens, but then they finally fall out and you need lots of money to replace them. But here's my point. Dentists are very good at replacing teeth. You do wonderful implants, so as long as you want to spend the money, basically no big deal. Except it being stinky and not so good looking during that time already. But what about this gum disease? A gum disease is an infection, and it's like if your thumb gets infected, your finger, and you cut it, if it gets infected, it gets that yellow, reddish, ugly pus. That's what's in your mouth. And the way I see it, it drips, it goes into your bloodstream because the mouth is the gateway to the blood vessels. That's why when we are unconscious, we take a little bit of whatever it may be, cayenne pepper or whatever it is, put it on your tongue and or under your tongue, and you become alive again. So you have that ugly infection dripping into your blood and ruining your kidney, your liver, improving the diabetes, damaging the nerves, the stomach, the heart, the whole blood, a stroke. Women get premature born babies. Because of that, the babies are underweight. It looks to me that this is a much bigger problem than losing your teeth, because at least your teeth can be replaced. It's not the same than your real teeth, but you guys are good at replacing teeth. Now tell me whether the accusation I made about these illnesses, whether there's any truth to it, or whether I am just, have heard rumors and seem to be wanting to pass them on to you.
Okay, all the gum disease or any in the mouth, our mouth has a lot of bacteria, and those bacteria actually directly relate to the heart disease. So same bacteria in our mouth, it causes the heart infection. So it's very dangerous. So if you don't take care of your gum, the same bacteria go to the bloodstream and go to your heart, and you can have a serious heart problem. So it's a gum disease. Not only you lose the tooth, only you can lose your life. So you have to think about this very seriously. Right. And not only that, you cannot eat properly. Also, your mouth got the infection. Those infections can cause all your general health problem. So this one is a very, very serious problem.
Right. Now, let's talk about this general health problem. I mentioned a few of them in specific. Are they true? Kidney disease, liver problems, diabetes, women having, in fact, in California, there was a lady who had a stillborn baby because they found gum disease infection in her placenta. But many women have premature births. In Japan, there's a study that the immune system is going so low with people who have gum disease that if they have HIV infection, which in itself is not AIDS, but it can turn into AIDS, and because the immune system is so low, people with gum disease are much more easy to get HIV, to get AIDS from HIV. Now, obviously, those are rare cases because, thanks God, not many people have HIV. But if it can do something so drastic, wouldn't it also bring the immune system down and make people more susceptible to the cold, to the swine flu, bird flu? Never mind swine flu, bird flu. Just the next flu season, which is for sure to come once or twice a year. Wouldn't that all infect it? Are those specific, areas? There probably are more. If liver, kidney, and those things can get affected, there probably are more. But are those ones part of the list which you say yes to?
I can say when your immune system is low, your body, all your body organ can get illness. The same thing for your mouth. The same thing when you have a immune system is low, you can get all kind of oral infection. You can get gum disease, or you can have a bone loss, all kind of infection you can have, same like your body.
Right. Okay. So basically the answer more or less is yes. Let me ask you this. Lately, the last couple, 2-3 years, probably before a little bit also, but the last 2 to 3 years, very, very heavily, surgeons, people who take out the appendix or the tonsils, or people who do hip replacement with titanium, the way you do with implants, those surgeons lately are demanding from their patients before surgery to get an oral health, a good bill of oral health, mainly to get a periodontal disease checked, because they don't care whether you have a crooked tooth, they don't care so much about a filling or not being down a cavity, but they care about periodontal disease, because they say, we have found that if you have a periodontal disease and we operate your hip or your appendix, the chances are that our operation fails is much, much higher, because all that infection is in the blood and it makes our new wound become very dangerous. Is that true? Have you noticed that?
That's right. Of course, patients who need artificial joint or hip joint surgery, they must see the dentist before they have the surgery. They have to take care about their gum disease first before they get all those surgery. So it means because those bacteria can directly affect the infection for the joint or those artificial part. That's
right.
True.
Right. And the body, they say, those surgeons, they say the body is again predisposed. It's already weaker in the first place. So never mind the infection infecting the actual area which they then cut, but the whole body is weaker, and you can only weaken a body so much and then still operate on it. That's why sick people, basically you can't operate because they're too weak. They will not survive the operation. And it looks like surgeons have determined that gum disease is quite a heavy illness. And if that's true, I mean, my God, people should fix it. So let me ask you another question. Have you noticed, and is that, the data that these days much, much more people have gum disease. Most people have some form of gum disease, maybe not most, but a huge percentage. And like cavities are slightly going down due to the fluoride or whatever it might be, but gum disease is rising. Did you notice that in your own practice, with your own experience?
Oh yes, when the age, especially when the people getting old and they getting more gum disease. And when the young age people, they have some more cavities, but getting old, they're getting more gum disease. That's true.
And when you say old, what are we talking about? 80, 90, 100, 60, 40, 50, 30?
Old means like after past like age 20s, beginning of the 30s, they're already getting the gum disease. Because of
You're calling 20 and 31 years old.
Because those ages, it's the teenagers, most time they get a cavity is a problem, but
right.
Age about 30s, they're already getting the gum disease start. So they getting gingivitis, and they ignore the gingivitis, it becomes the periodontitis. Then they're losing all the supporting bone, and then they can get a serious gum problem later on.
Well, I cannot even point out the importance of your statement. I think, people with 20 and 30 having gum disease, imagine, I mean, a person at 30, let's just say 30, he lives literally for sure another 50 years, 60, not that unusual these days anymore. He lives another 60 years, and he has an infection in his mouth, which, tell me whether that's true. An infection, a gum disease infection, is as big if it's relatively all over the mouth, and it usually gets soon all over the mouth, but it's as big as your hand. Is that true?
Yes.
Now, imagine if you and me, or most people, if we on our skin, on our hand, on our leg, on our neck, somewhere, if we have an infection which is as big as a penny, and it doesn't go away within a couple, 2, 3, 5 days, a week, 2, whatever, we probably run to a dermatologist very fast, right?
That's correct.
As we should. As we should.
Yes.
But we have an infection which is as big as a dollar bill, and we don't go to and fix it, and we have that poison dripping in our blood all the time and getting mixed up with our food and getting directly, put into the stomach, and from there it spreads. So it spreads from two places, one the stomach and then we wonder why we have a host of illnesses which makes us fatigued. Again, a lowered immune system, any infection makes us fatigued, tired, exhausted, and then we wonder why we are not our good old self the way we think, and we attribute it to old age, and that at the age of 40, and that's just not good. Looks to me we need to fix it. Anything you have to say before I end off here on that? I think this is more important than people can possibly believe. Anything you have to say? Any advice?
Many people, especially the gum disease, I want to tell about that. But the gum disease, in most cases, there's no symptom at the early stage. When the patient, they come because they feel something is already too late. Because the problem with the gum disease, there's no symptom until the final stage.
No pain.
So early detection is so important to fix the gum disease. Because at the young age, you have to start the good habit like flossing, brushing properly, and see the dentist regularly. That's the best way you can prevent all the serious gum disease.
Right.
Please go to your dentist, and then you have to check up before it got too late.
Because at whatever stage, tell me yes or no. At whatever stage a person has gum disease, whether it's a little bit with gingivitis, which is an infection. The infection is just not big like a dollar bill. It may only be small like 2 or 3 or 4 quarters. But at whatever stage the infection is, a dentist with periodontal surgery, with gum disease treatment and medicines and whatever, antibiotics, whatever it may be, can get rid of that infection. Is that a yes or is that a no?
Certain stage, you can use some kind of medication to relieve the symptom. But for the gum disease, you need the actual treatment, because the medication, it can just temporarily relieve the symptom. For actual treatment, you need the actual gum treatment. That's the only choice.
No, I do understand. But after the gum treatment, which is a gum disease surgery, whichever means it is done, it is fixed, like appendix. It is fixed after the treatment. Yes or no?
We cannot say it's okay. What I can say is it's fixed, but the fixed, it does not mean it's everything. After fixed, you need a good maintenance. Without the maintenance,
absolutely,
it comes back. Yes.
No, absolutely. I mean, if I fix an infection on my skin, or whatever infections I have for whatever reason, I gotta maintain it one way or the other way. You know what I mean? It's like with weight loss. You can fix it with a weight loss program, but you need to work on it the rest of your life, obviously. You understand? I got it. Absolutely. But it can get, this major infection can get taken out very fast, and then you're back to beautifully having to maintain it and not get it anymore, because you got it because of bad maintenance in the first place. And if you fix it and don't maintain it, you will again get it.
That's right. You can get the infection again, of course.
No, absolutely. Yes, I got that. Well, wonderful. I appreciate your candidness. I appreciate your wonderful information here, and I hope people take it to their heart. Thank you very much.
Thank you very much.